In this episode of the Nurse Practitioner Podcast, Dr. Karen Higgins and Dr. Olivia Newby discuss DNP Student Mentorship. Tell us about your organization and why you started a mentoring program for DNP students.
The organization, the Virginia Council of Nurse Practitioners, is a state organization, and it has 12 regions, and we are in the Tidewater region, which is the second largest in the state. The organization has over 200 members, and our recent number has increased all the way up to at least 300. Our attendance at our monthly meetings often are about 60 members, and it includes nurse practitioners as well as nurse practitioner students. We started the mentoring program for the doctorate of nurse practitioner students to enhance the leadership experience with a goal to have the students to be equipped for the next level of leadership, either at their workplace, their organization, but to have a strong foundation of leadership.
And then it also helps the students. By offering this initiative, we provided experience to help them achieve competencies of the essentials, such as leadership and policy. And we feel these opportunities were unique from what they could get in their workplace or other clinical sites. So we found this initiative benefited both the organization and our students.
How did you start the mentoring program?
We started the mentoring program by inviting the doctoral nurse practitioner students to join the board because they already had a understanding from the coursework of leadership. And as a recent graduate of my doctoral program, I found that this professional organization had the capability to provide the students outside of their workplace to be chairs of various committees and various programs within the organization to enhance their skills to become leaders.
What were the students' responsibilities in the organization?
The students' responsibilities in the organization consisted of government relationship, which involved being involved in our political action committee, establishing a legislative reception, a nomination and award committee, which was in establishing scholarships for doctoral of nursing students and nurse practitioner students. And the other responsibility was our education chair and chairing a pharmacology conference that included a continuing ed educational unit.
How did the students benefit from the mentoring?
The students benefited from the mentoring by gaining experience to help them achieve their DNP essentials. For example, in leadership, some of the students didn't have leadership opportunities in their own workplace. So by joining the board and becoming involved in the organization, they build the leadership skills of establishing budgets, setting goals. They participated in organizational leadership. They also had the opportunity to try new initiatives. And with the support of their mentor, they implemented these innovative new ideas, which really helped to grow our organization. For the DNP Essentials for Advanced Practice, again, the pharmacology conference that was established, they helped plan that and implement that. And based on that success, one of the DNP students decided to organize and plan a procedure skills workshop, which we implemented last year. And again, that was also very successful. We feel the real niche, though, that organizations provide is helping students meet the competency for policy and advocacy. We provided funds for 3 of the students to attend a National Nurse Practitioner Policy Conference that ignited their passion for policy, and they shared that enthusiasm with our membership. They also got involved with policy initiatives at the state level within the nurse practitioner organization.
How did the organization benefit from the mentoring?
The organization benefited from the mentoring by increasing membership at our monthly meeting, increasing membership as a whole in terms of starting from an increase of about 33% of total member for that year. And they benefit by bringing new ideas to the organization, benefited from bringing not only new ideas, more engagement, and it brought the older members with the new members, younger members together, and our ideas were able to enhance the organization as a whole.
What are your recommendations for organizations that are interested in starting a mentoring program?
If organizations are interested in starting a mentoring initiative, what we would encourage them to do is to actually look around at their current members and the leadership and identify strengths, just different opportunities and expertise that they could offer to DNP students, and then offer to mentor them or invite them to join the board and leadership positions. As nurse practitioner education moves towards a DNP degree for licensure, students aren't going to bring the connections with advanced practice providers that the postmaster's DNP student has. So this is really an area where nurse practitioner organizations can fill that gap. They can help bring connections and relationships with students and other advanced practice professionals. We also encourage faculty to get involved with organizations. They need to model that for their students, that they too are invested in their professional organizations, and they can be a bridge for students and organizations also. We believe that mentoring is an investment in our profession. It empowers organizations and nurse practitioners to advocate for the nurse practitioner role and advocate for our patients and communities to improve health. And we do this through advocacy, policy, and education. Again, those are the three main experiences that our organization provided for our students.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.